Thank you for joining me today. In this video, we are going to go over antipsychotic medication and the high yield you have to know for the exam. Antipsychotic medication are divided into first generation antipsychotic medication and second generation antipsychotic medication. For the exam, you want to focus on the mechanism of the medication, how potent is the medication, and the external pyramidal syndrome or EBS symptoms. You want to also focus on the metabolic side effects and if the medication prolongs QT. Also, you want to focus on prolactin. If the prolactin increases, if the medication needs monitoring, lab monitoring, we want to also go over clozapine monitoring. We want to begin on the first generation antipsychotic medication. First generation antipsychotic medication primarily mechanism is that they block dopamine D2 receptor agonist. There is a high potent and low potency in first generation. The high potency medication like the Haldol, they have higher EBS symptoms and risks. They also have the side effects of neuroleptic malignancy syndrome. They treat acute agitation. Vaccine has also high EBS symptoms and risks. Triflubarazine, and flufenazine and Haldol have a highest potency and they cause high EBS symptoms and neuroleptic malignancy syndrome. High potency leads to more EBS symptoms, tardive dyskinesia, and neuroleptic malignancy. However, they have a low sedation, they have a low risk of orthostatic blood pressure, they have a low risk of causing anticholinergic syndromes, anticholinergic effects. Low potency first generation antipsychotic medications cause sedation, they cause orthostatic blood pressure, they cause anticholinergic effect, they have a low EBS risks or extrapyramidal symptoms risk. However, they have a significant risk for increasing QT prolongation. The low potency first generation antipsychotic medication include chlorpromazine and thyroxine. For example, thyroxine has a significant QT prolongation and also have a significant of anticholinergic effects. First generation medication that has low potency or low potency, they cause more sedation, they lower the blood pressure, they have anticholinergic effect, they have more metabolic effect. However, they have a low EBS symptoms, extrapyramidal symptoms. So high potency medication of the first generation antipsychotic medication, they have also high EBS symptoms. Low potency medications of first generation antipsychotic medication, they lead to anticholinergic side effects, sedation, and low blood pressure and orthostatic blood pressure. Second generation antipsychotic medication primary mechanism is that they block dopamine. They are dopamine D2 antagonism, and they also block serotonin. So the second generation has two. This is how you're going to remember. Second generation blocks two neurotransmitters. Second generation blocks two neurotransmitters. They block dopamine and they block serotonin. Generally, they have less extrapyramidal toxicity. They cause less EBS symptoms and toxicity compared to first generation antipsychotic medications. Although they have less EBS symptoms, they cause tardive dyskinesia, major second generation antipsychotic medication that you want to know, clozapine treatment resistant antipsychotic, treatment resistant schizophrenia. It also needs to be monitored. You have to check the absolute neutrophilic count, and it can cause myocarditis and seizure and constipation. Olanzapine or Cyproxa causes major weight gain. It increases the appetite. It causes weight gain. It leads to metabolic effect and is the highest psychiatric medication that increase the weight, that leads to it can lead to diabetic and lipid increase, hyperlipidemia. Seroquel side effects include sedation, and it lowers the blood pressure. It leads to orthostatic blood pressure. It also affects the metabolic and increases the weight. It causes sedation. That's the Seroquel. Risperdal has a higher hyperprolactemia. It causes higher prolactin. It causes higher prolactin. Risperdal, when you remember Risperdal, remember that it causes increased prolactin. Beribabradol causes also increases prolactin. it also increases active metabolic Bobrazole. Bobrazole is a partial dopamine agonist. Bobrazole or Abilify causes akathisia. It blocks dopamine partially, but it causes akathisia. Sabrazodone and lorazepam. Sabrazodone and lorazepam both are second-generation antipsychotic medication. Sabrazodone increases, it has a risk of QT prolongation and relatively has lower metabolic risk, so it don't increase the appetite that much. Lorazepam treat bipolar disorder, schizophrenia, and has a lower side effect of metabolic risks. It don't increase the appetite. It has a lower chance of increasing the appetite and causing side effects such as blood sugar, weight gain. Azenabine is the second-generation antipsychotic medication. Azenabine has a sublingual format, and it also treats bipolar disorder. Carbaprazine treat schizophrenia and bipolar and can increase the risk of akathisia. Brexpiprazole has a partial dopamine agonist. It treats schizophrenia and depression. So some of the side effects of the schizophrenia, some of the side effects of antipsychotic medication include weight gain that leads to increased risk of diabetic, lipid, increased hyperlipidemia, high blood pressure, increased prolactin, increased prolactin, risk of akathisia or abnormal muscle movement. Some of the psychiatric medication increase the QT prolongation, increase the risk of QT prolongation. You want to assess the risk of the QT prolongation. You want to check the EKG, and you want to assess if the patient has a risk of cardiovascular risks. If the patient already have risk of low blood pressure, or if the patient has the risk of banal metabolic risks, you have to assess before you prescribe this medication. Antipsychotic medication side effects is that it increases the EBS symptoms. EBS symptoms or extrapyramidal symptoms include acute dystonia, hour or day after the patient take the medication, EBS symptoms. EBS symptoms or extrapyramidal symptoms include acute dystonia that happens hours to days after the antipsychotic medication, and the signs is neck snaps, jaw snaps, and the treatment is a benzodiazepine. Acute